We're going to go ahead and do catheter care. Jack is getting ready for the night, so we're going to disconnect him from his day bag he's connected to, get him cleaned up and ready for the night. So I'm going to make sure I have my handy dandy urinal. I got a new brief I'm changing into and got some wipes to clean him up. Your trash can should be nearby as well, and you're going to be wearing gloves also. The first thing I always do is I always take my urinal and I empty whatever bag I'm connected to. This is going to help make sure it's not going anywhere it doesn't need to. I don't want to risk picking the bag up and sending that urine back into the person. Once you've emptied it, I'll normally have a little piece of tissue or an alcohol wipe. Wipe this off so I know it's not dripping anywhere. You're going to take this and dump it down the toilet, nowhere else. Okay. All right. So now the bag's emptied. Let's get them all nice and cleaned up. Again, I am wearing gloves. I'm going to go ahead and pull back the tabs of the brief and pull the brief down out of my way. And I'm going to have my wipes and my clean brief nearby. I am going to start by cleaning him up in front using my wipes. I am going to use one of the corners starting up at the front, pulling straight back. I kind of go at an angle, I guess, from tip to hip is what we always say in the classroom. Going to go to this side and then once right up the middle and going along the back side, tucking underneath the testicle as well, pushing as far back as I can. We're always going one fluid motion. We're not doing any scrubbing in this area. Okay. I always will at this point undo their little band-aid or little sticker guy they have here, and I am going to clean down the tubing. And when I do this, I am going to pinch and hold, not so I'm cutting off flow, but just so I know when I come and pull down this, my client's, not feeling all this. Okay. Nice and gentle. And I'm always going to go towards the bag. This tubing isn't always clear. You can't always see what's happening in here. So I always want to make sure anything in here is leaving the body, not going back up in. That is called backflow, and that is no good. Okay. So now he's nice and cleaned up. His tubing's cleaned. I am going to disconnect my bag from my client by just giving this a good pull. I will always do this over the brief. Again, this isn't always clear, so if I open this and should urine come out of it, it's going to land in the brief and do its job. I have my my night bag posted up on the bed, so I have my new tubing ready nearby to go. If you're questioning if this is clear, give it a good clean. If you're questioning if it's clean, give it a good wipe down with a rubbing alcohol wipe. Once you've given that a wipe down, you can then insert this piece into here. This is almost always going to be the hardest part, especially if this is a new catheter. This isn't always the stretchiest. So just kind of work your way in. I kind of give it a little twist as I go. All right, it's not going up anymore, so I know that's good. I'm not going to worry about connecting it yet because I have to turn Jack on his side and I don't want him to lay on this tubing. It's probably not going to be the most comfortable. I'm going to put this brief, tuck it out of my way so he's not laying on it. And I'm going to help my client roll towards me. I'm going to help him bend his leg a little bit, give me a little pocket here at his thigh to hold on to, and I'm going to have him reach for his bar. And once he reaches for her bar, this gives me a little pocket here at the shoulder to connect to. But Jack's pretty good about holding himself up, and we'll just loop on there. From here, I am going to finish cleaning up the backside. Always good to give your client a good wipe down front and back. Again, kind of doing the clean corner, starting up as far as I can, moving down towards one cheek, moving that corner out of my way, going the other way, once right up the middle, and wiping along back, making sure anything I've pulled back isn't hanging out. All my dirty wipes are in my dirty brief. I can ball all this up and throw it in my trash can. And then I'm going to get my new clean brief. Tabs go up and at the back. And I always recommend keeping them folded over so they don't catch on everything. And you're going to carefully take that extra tab and start to push it underneath your client. Be careful though, because you can over tuck it. So I always recommend pulling up the brief, making sure that you're hugging the body correctly and that you got everything nice and covered how you want. Once you look good, you are good to help your client lay back down and relax. Then from here, make sure some of this tubing is in with your client. They can go around it should they need it. You're good to close this piece back up. And then make sure to tuck the penis down before pulling the brief up. We don't want to pull it up and have it angled up pointing at ourselves. It's not going to be too comfortable. Then you're good to close up the brief and you're done.